Welcome all my viewers once again today on this live program on Beyond Sugar. It's always a pleasure to be connecting with all of you for this live interactions. As you're all aware that Beyond Sugar is created for all of you in scientific collaboration with Indian Society of Nephrology. Now, not only we post information on a daily basis for you so that you can be updated about your health issues, but also to interact with you. We invite leading doctors from across the country who can talk to you as a friend and answer the questions which you have in mind. I'm very glad to welcome Dr. Hemal Shah, who is from the city of Mumbai. Sir, welcome to the program.
You.
We get some chats and some questions about the potassium levels, especially for the kidney patients and hyperkalemia, and people want to know a little more about that. And today we thought that we will use your expertise, sir, to talk about on this subject and answer the questions. But before I start taking the questions from the audiences, let me formally introduce Dr. Hemal to all of you. He is one of the leading kidney specialist nephrologist in the city of Mumbai, and he is a scholar of International Society of Nephrology. He's also been a fellow of University of Toronto at Canada and University of Missouri in US. He has been the past secretary of Mumbai Nephrology Group. Currently, he is a consultant nephrologist at some of the major hospitals in Mumbai, which are Breach Candy Hospital, HN Reliance Hospital, and Safety Hospital, and providing services to his patients. So let me hand it over straight to you and get you in for setting the context on this topic, hyperkalemia. That if you can start by setting the context that what is actually hyperkalemia and why it is important for patients to understand about this situation.
So, Sanjeev, thanks for this opportunity. And I really think for once, this is a great use of social media. We spend a lot of time and we see a lot of our patients and kids and everybody using social media to see reels and, do all kinds of fun things. And this is actually a very effective way. Patient education has always been a forte for me. And, in a city, today, as in a city like Mumbai, it's very easy for us to use social media to get across to people. And now you're giving me this opportunity to go national. So I'm very happy to do this program with you. Coming to hyperkalemia, this is something which, uh, this is a very common problem as far as a. So I'm talking primarily as a kidney doctor, what I do and what I see, and and then we try to extrapolate that to how to kind of extend it to the common people, to the non-kidney population as well. So first of all, it's a very common problem. It is a very dangerous problem because hypokalemia can cause life-threatening situation, and it is actually preventable or correctable. So this is something which we see every patient that comes to us. We are like kind of looking at the potassium levels because we focus on that. So this is how big the problem is, and how this topic is why it is so important for everybody. Potassium is a very important element in the body. This is a intracellular element which is inside the cells, and most of it, 95% of it is inside the cell. And what we measure in the blood is only the 5% which is circulating in the body through the blood. But it is a very narrow range. So the normal range of potassium is 3.5 to 5.5. And this is something, both sides of it, if you go low potassium or high potassium, there could be very dangerous situations which we will discuss. So that is why this becomes important. It is important in uh, all kidney patients because every time kidney patients are unable to flush out the potassium, the levels can go up and it can cause trouble. It is very important in a large chunk of diabetic patients, which means you're talking about one fifth or one third of the fourth of the adult population. So, because we have a large number of diabetics in our country, and in addition, there are certain very unique situations where potassium can go high and it could happen to anybody. Let me give you, most people will be surprised to hear this because we are currently in a situation where Olympics are going on, everybody is glued to the TV looking at how athletes around the world are doing it. A run, a simple a morning run, which can break down your muscles, can cause a gush of potassium released into the bloodstream. So it is something that can happen to anybody. Doesn't happen because there are checks. The body is made such that the critical events are kind of prevented, but it can happen due to even something like an extensive muscle injury. So that is why this webinar becomes important.
Okay. So I think that's very, very important points shared by Dr. Himal with all of us. Three things I largely, pick up. He says that hyperkalemia and related issues related to potassium, in kidney patients, they're common. So which means that, all of us should be aware of it and we should be knowing about it. Secondly, he also mentioned that this is dangerous. So which means that, we need to be cautious and also alert about this situation. And also importantly, third thing he mentioned that it is treatable, which means that if all of us are aware about this, then probably we would be able to take timely action and talk to our doctors as well on this. Sir, you mentioned this whole situation that how does it the body regulates, and then finally how the potassium levels, what are the right values on it. So are there any major causes for this potassium level going deranged and having hyperkalemia?
Yeah,
Are there any specific group of people who may be at a higher risk of getting this hyperkalemia?
sure. So first of all, potassium is it comes from our diet. A large chunk of it comes from vegetables and fruits. So whatever we ingest, there is a big chunk of, and we are predominantly a vegetarian country. So there's a large quantity of potassium being ingested with each and every meal. What happens with the digestion of this potassium? There's a surge of the potassium levels in the blood. That as the blood goes and filters through the kidney, there's a lovely mechanism by which the kidneys understand what is normal range, and anything above, if the blood levels are above that, then it starts flushing out extra potassium through the urine. And if the reverse is happening, that is, if you're not ingesting enough potassium or you've lost potassium for some reason, the kidneys are able to pull back potassium from the blood and keep it in the circulating blood and prevent it from being lost in the urine. So this is what is known as a normal homeostasis. Now, so one scenario could be wherein a person ingests a large quantity of potassium. The other thing I told you was that potassium is an intracellular element. So this most of the potassium is stored inside the cell, and at that point of time, it doesn't cause any irritation or it doesn't cause any trouble. But moment high quantities of potassium are led into the bloodstream in the circulation, that's when it can play havoc. So anything that can break down could be a sudden injury. Like say if you had a crush injury on your leg, then there is a breakdown of a lot of muscle. Large quantities of potassium will go into the bloodstream. And as I also mentioned, it doesn't have to be an injury like in a landslide as we've unfortunately recently experienced. It could be in a massive marathon running where there's a lot of wear and tear of muscle and a huge quantity of potassium could be released inside the blood. So high quantity coming into the blood. But more commonly, this is obviously, as I told you, taken care of by the kidney. But what happens if that kidney is not efficient in filtering the potassium? Then this whole mechanism becomes, stretched, and potassium levels in the body will rise. So if the kidney normally is supposed to take care of 100 milliequivalents of potassium, but because it is functioning less, it can only handle up to 50, then in that case, 50 milliequivalents of potassium is going to stay back in the body and the level will have risen. And then with every subsequent meal, the potassium goes on rising, creating a possible irritant situation to various body functions. So these are the two reasons why it happens. There is a system called the renin-angiotensin-aldosterone system, which normally in the kidney does the filtering and keeping the potassium levels within the range. It's fine tuning the potassium levels in the blood. Now, if there is a problem wherein these this system is underactive, or there is a lack of its normal functioning to keep the potassium well flushed in the blood, then the potassium systems can rise. And this is one system which we see in diabetics very commonly, and it's called type 4 RTA, renal tubular acidosis. The problem is in the kidney. Kidneys are working well, there's no problem in the functioning of the kidney. But so the kidney function is at 100%, but the tubules have a limited problem of flushing of potassium, and high potassium levels can occur. There are certain drugs which are very beneficial to diabetics as well as kidney patients, controlling this renin-angiotensin system. And those drugs, by controlling this mechanism, take away the natural flushing that this mechanism can do for in high levels of potassium. So that is where, if the patients are on these drugs and they are consuming large quantities of potassium, there again can be a potential hyperkalemic situation.
Okay, so I think our viewers are provided with a lot of science here, and but I think it is absolutely necessary from that perspective to understand that how the body functions and how the kidney functions, and how the dysregulations in the body's functions can lead to higher potassium levels. So now, coming on to, let's say, common viewers who cannot control some of these, internal body functions, as you mentioned, but for them it is very important to know what is in their control. Like, for example, are there any commonly used medicines? One thing you shared, that okay, it can be due to severe injury, muscle breakdown, so people are aware and they can be careful about that. But are there any commonly used medicines which can lead to, let's say, high potassium influx? Or are there any dietary factors, some things, which are taken, which can, lead to such situation? If you can let us know, then I think people can make a note of it.
So make no mistake or understanding this part. Medicines can only be problematic if the diet is disturbed. Diet is one and the only reason why potassium levels can go high. You are eating a lot of something that you are not permitted to eat beyond a certain limit. So if your potassium food in your food is beyond the limit that one you are being permitted, you are being naughty about it, that is when the body is loaded with potassium. And in that situation, wherein you are being given some great medicines which are kidney protective, and every diabetic is supposed to be on it, they also help the heart. They are actually a must as far as the heart and kidney are concerned, like the renin-angiotensin systems or the MRAs, both of them, which are wonder drugs to protect your kidney and heart if you are able to control your potassium in your diet. If that is possible, then these drugs do not create any trouble. But if you are taking these medicines and you are not listening to your dietitian and your doctors, and you're consuming food substances which are very, very high in potassium, that's when the trouble starts. So it's a combination of the two. The drug alone will not do it because the potassium that is coming in will be filtered in the limited capacity of the kidney. But if it is coming in large quantities, then the drug will prevent the flushing to the extent that the body would want. And that is where the trouble comes in. So the diet is the biggest problem in these patients who are on these medications. The medications itself are extremely beneficial. So we're talking about ACE inhibitors, ARBs, and mineralocorticoid inhibitors.
Okay, so I think this is a very, very important point which Dr. Himal makes out here, and I think we all can be making note of it, that medicines alone may not, let's say, make the damage unless your diet is also not, equally out of control. So whenever your doctors are prescribing you certain medicines, so they will also guide you, like, what to eat, what not to eat along with that. So take some of those guidances very, very, seriously, because otherwise they can create such issues, which Dr. Hemal just mentioned. Sir, you earlier also mentioned, in your conversation, that other comorbid situations like diabetes, hypertension, heart failure. These can also the precipitating factors for hyperkalemia. Can you just help us explain that? Is it like, what kind of damage do they do in such a situation, and what's the advice for patients?
So again, diabetes can I've already told you about the fact that it can cause they have tubular problem wherein the aldosterone renin system is not efficient enough to exchange the potassium, and this is where high potassium in the blood needs to be flushed out, and that is not being done adequately. Similar situation can also arise in heart failure, and it can arise also from enzyme like adrenal problems, wherein you have adrenals are very important glands which are present above the kidney. This is also adrenal, and these are ones which all of us are aware of the hormone cortisone. There's another hormone called aldosterone. So both these are also involved in keeping the potassium levels under check. And if there is a disturbance of these hormones, there can be changes in the potassium level. So heart failure, um, adrenal problems, and direct tubular RTAs, which I talked about, these are other conditions where potassiums can go up.
All right. So if you have uncontrolled diabetes or heart failure as well, so just be a little more cautious about it. You may be at a higher risk, and you need to be talking to your doctor on this. How can someone, sir, identify now? Generally, if he goes to a doctor, the full investigation is done. It will be, of course, be easily diagnosed. But for a person, who is not going to the doctor, let's say every other week or in a fortnight, then are there any early symptoms, warning signals which someone should be looking at, that these can be the early symptoms of hyperkalemia?
So I think let me share some stories here. So let me give you the example of a young man. This patient was admitted because he could not move his limbs, and this was like a paralysis that had occurred. And when they did their routine blood work, they found that the potassium levels were very high, and this turned out to be what is known as hyperkalemic periodic paralysis. The high potassium levels led to muscle inactivity of the muscles. Now, this situation, the patient presented with lack of movement of the muscles. Now, we identified potassium being high, it was treated, potassium levels were brought down, and the patient slowly recovered from his paralysis. So, this is something very unusual, very rare, but this is one of the presentations that it can occur. Now, recently there was another man who came to me with a history of giddiness. This person he's my regular patient he has a kidney problem, and he suddenly developed giddiness. And when I examined him, I found his heartbeats were abnormal. So the normal number was uh, ranging from fast to slow, not being consistently same, and the gap between the two beats was extremely erratic. Now that is when we realize that he has what is called as arrhythmias. That is, the rhythm of the heart has gone bad, arrhythmia, and that is what he was diagnosed. An ECG was done, and it showed me that the heartbeats were abnormal. But it also showed me certain signs on the ECG, what is known as tall T waves, which told me that hey, this could be because of potassium. And then so that was and we had already sent the blood that came back in about an hour or so, and the potassium was extremely high. We could control it and still bring down the potassium, and his irritability of the heartbeats so slowly settle down. So these are some of the ways in which a patient with high potassium levels presents to us. Then there is a larger group which will have high potassiums in their blood, which are detected on routine checks because they go into executive checkups or they do regular monthly tests as advised by the diabetologist or whichever specialist or whatever organ they're having a problem with, and that is when they see a high potassium level. And here we get a chance to prevent any such complications of arrhythmia or paralysis or any such problem, and treat the potassium even before it starts all these dangerous complications. So that is how patients will be picked up.
presented. All right. So I think he mentioned some of those, symptoms, that how you can, what are the presentations in such a case. Sir, also please tell us that, if someone is in the high risk category, you as earlier mentioned, and he also, observes certain symptoms like you mentioned. So what are the next steps? Should he be going to his family physician? Is he fully equipped to, handle the whole situation? Or is it time for him to visit, a hospital where full investigations can be done, or visit a trained nephrologist? What's the advice here?
So usually, the first thing is this. So let me first, like, let me take a step behind. So people who are at risk, like say for example, you're talking about your diabetics, you're talking about people whose kidneys are suboptimal. These patients are even warned about consuming a high potassium diet. So you're talking about avoiding high potassium fruits such as mango, bananas, you say avocados, but potatoes. So these are very high. What you are allowed are low potassium containing fruits such as apples, papayas, pears, pineapples, some citrus fruits. So these are the ones which are relatively considered potassium low potassium, and therefore they are permitted. So if you stick to that, then you're reducing your chance of developing high potassium. Second one is we advise them to leach their vegetables. That is, we ask them to keep the vegetables for 30 minutes in warm water, and then cut them, cook them the way they want it. The potassium will get leached out. That is, it is drained out of the vegetables, and the food becomes less potassium containing, and therefore doesn't cause high potassium. So these are preventive steps that are already there. Now, if the patient goes with a report of high potassium and the general practitioner sees it, he could do an ECG. Some of them are comfortable in doing it and treating it, and the others are not. So they kind of refer these patients because the risk of heartbeat problems is high. They refer to a kidney doctor to deal with it. Now, in that situation, the ECG is the first thing that we do. We see if there is already an irritability of the heart coming in with the high potassium level. If it is not so, then we have time. So the patient is given the advice of how to first cut down the new intake of potassium and how we try to flush it out of the body. Now, the treatment is divided into three parts. As I said, one is prevention, preventing more from coming in. So, warn them about being strict with their diet. Second thing we tell them is immediate steps we take in which so that the potassium which is in the blood goes and hides in the cells. So we buy time. And there are some injections that are available. Like for example, we give injection calcium gluconate, which is which doesn't do much to the potassium, but it reduces the irritability of the heart cells. So the heart will not have any rhythm problems. It will be immune to the irritability brought in by the potassium. So calcium gluconate is one. We give injection soda bicarb. This is something that helps create a alkaline environment inside the body, and this causes the potassium to again get into the blood cells, inside the cells, down in the blood. Third is what is known as glucose insulin drips. This is given as as an infusion, an IV drip, and here the glucose itself, and now sometimes we give glucose, and the natural insulin produced by the body adds to it, and the combination of this makes the potassium go intracellular. Or sometimes we give it as a combination. This again helps to reduce it. Sometimes we give, a lot of the asthma patients or people who have seen patients with asthma will know what is nebulizer. So it's a method of giving medicines. Here, a medication is put in a liquid form and it is pulverized into small particles, and the patient breathes it into the lungs where the desirable action takes place. Now, there are certain bronchodilators which we give for asthma, salbutamol and similar. They've got beta adrenergic agonists, which actually help with the same process. So these things are done to buy time, and the blood level of potassium comes down and it goes inside the cell. But it has not left the body. The next step will be to slowly flush it out of the body, and the only way to do it is through the kidneys. So here sometimes we use diuretics, that is, you make you pass more urine, that will flush out potassium through the urine and slowly make it get out of the body. So this is another one. And very rarely in people whose kidneys are not optimal and they're not functioning well, and this flushing out through the normally functioning kidney is very, very difficult or very, very inefficient, then these patients are taken up for an urgent dialysis. Dialysis is the machine replacing the kidney's job, and it removes the potassium very rapidly. In 3 4 hours, we can bring down the potassium level to normal. So, this is what the treatment would entail.
All right. Thank you so very much. I think you took a step back and in one go told us about the preventive measures also and some of the treatment options also which are there. Since we are also running out of time, I'll just take one last question, and that's around monitoring or screening. So if someone is detected with hyperkalemia or this, so are there any recommendations that how frequently this should be monitored, or if someone is at risk, then is there any norm on screening so that it can be identified and corrective actions are taken?
So, um, so you know what? So every patient has to be true to themselves. So if they are being very diligent about their diet, then well, once in a month or two, when they're recommended based on their level of kidney function, they're asked to follow up with a kidney doctor. That could be more than enough. But I've had patients who've been told that mangoes are bad for you and it will raise your potassiums. Then in that situation, they go and check their potassium every week so that they do not harm themselves. I also want to mention that there are certain medications which are available. Um, Unfortunately, there are about three very popular medicines which are available, but there is only one that is in the world, and in India there is only the polystyrene, the calcium binders, the sodium polystyrene calcium binders. So these are commonly prescribed to patients who are prone to hyperkalemia. It is taken after the at the end of day to reduce the potassium absorption from the stomach, which has so it's come through the diet, and these medicines prevent them from entering the bloodstream. There are others that are like which are not available in India, and those also like zirconium, and there is patamomir. So these are some of the other products which are not available, but they also help in the same process of bringing down potassium or preventing it from going up. So that is where we are currently.
All right. No, thank you very much, Dr. Hebel, for letting us know and making us wiser, all of us, on this whole subject. Not very much talked about, but very common, as you earlier said, and therefore, today we are making an attempt to make people aware about this whole situation, so that the timely action can also be taken in this regard. We have some questions. We are just completely running out of time here, and we'll probably conclude this program, and we will have a series of maybe around these programs to build more awareness and information about this topic. But before I conclude and say thanks to my viewers, I give it back to you, sir. Anything finally you'd like to say in the conclusion remarks, or anything very important which we missed and you want to emphasize in the end?
No, I think this is a good beginning. People who are in this area where diabetes and kidney and other things, or they have a loved one in this, do take these pointers home about checking it more often and making sure that you talk to your doctor and dietitian about how much potassium they can be given or how much you're permitted, and also be diligent about checking it if you have been cheating and having a lot of food substances which are not permitted, and if there is a problem, then corrective step is just around the corner. So please do reach out to your doctors. With that, I think I'd like to thank you all. Thank you to the team of Beyond Sugar for giving me this great opportunity, and I hope to see you in this space very soon.
Thank you, Dr. Hebel, and I must thank all our viewers who joined us either live or who would be watching this program later on. If you think that in your friend circle, in your family, as Dr. Hemant mentioned, anyone who is at risk, or who may have some of the risk factors in this situation, you can simply share the link of this program, and this discussion and conversation can be very, very useful for them. If you are living somewhere in Mumbai or in Maharashtra, western part of a country, you need more information, you can always visit Dr. Hemal Shah. He is available at Breach Candy Hospital and Sefai Hospital. But if you are listening to us anywhere else in the country, in some other city, and you have these symptoms or risk factors, so as you mentioned, connect with your nearest doctor, preferably a nephrologist at the earliest, without ignoring the situation. Thank you so very much, everyone. Dr. Hemal, thank you so very much.
Thank you,
Have a nice
Sanjeev.
evening ahead.
Thank you.
Bye bye.